Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
We have been telling you for weeks now about this particularly bad flu season that we're dealing with. More than 24 people have died across the country. The flu is widespread in every state except Hawaii. The best way to fight the flu is prevention, but if you already have it, Dr. Daniel Angeli, did I say that right? Okay. He's from Parham Doctors Hospital, and he's here to talk about what we can do to prevent it from spreading. We've had it coming through here at the station, so everybody's dealing with it. First, let's just talk about like the flux of it that you're seeing, the types of people that it's affecting.
Certainly, we are in the midst of the flu season right now. It usually comes around October, November. January, February tend to be our worst months, and then probably proceeds for about 8 weeks after that. So usually out to about May, we'll probably see flu people.
Okay. And how can people know what distinguishes flu versus something else?
Typically, it's classic signs of body aches, headaches, sore throat, dry cough, nasal congestion, those kinds of things, and fevers also. People are getting a lot of body aches this year we've been seeing. Okay,
so let's get into prevention. What are the steps people should be doing?
Prevention. First off, get your flu shot. It's still not too late.
Yeah.
Typically, we'd like to see you get it in October, November. It helps you build up your immunity. But if you haven't been sick yet, then get your flu shot, for gosh sakes. It's an important thing to do, and it can help you keep out of trouble, and especially if you're one of our people that are at risk. Our patients that are at risk are those very young, under 5, over 65 years of age. People with underlying diseases such as emphysema or asthma are especially at risk. Also our pregnant females. They're very important to make sure that they get the flu shot and treated if they get it.
And let's just talk about general hygiene to help prevent it. What can we be doing?
Wash your hands all the time, all the time. Certainly soap and water is a great way. 15 seconds of a vigorous scrub, soap and water will do just fine. Certainly we have all the alcohol products that are out there that we can use on our hands and do a great job also.
And let's go back to the flu shot a little bit, because some people have concerns about, even people who've had the flu shot this year are still getting it. So let's talk about the effectiveness of it. Should they still get it even if they're concerned that it's not going to do the trick? Absolutely.
It still does a great job with a lot of the flu that's out there. There's one strain out there in particular, though, that it's only about 35% effective of, but 35% is better than nothing. And so get the shot. You cannot get sick from the shot. The shot is dead virus, so you can't get sick from it. And again, it could prevent you from getting into really serious complications, especially if you're one of our at-risk population.
Yeah, because it can kind of lessen the impact if you do get it.
Tends to shorten the duration, lessen the symptoms, and get you back on your feet quicker.
Okay, doctor, thank you so much. We appreciate it.